Hey there, Toby Stark, Stark Associates Insurance Agency. Want to share with you a recent article that I've written about why people are leaving Medicare Advantage plans in New Jersey. And it's important to note that a lot of people may have enrolled in Medicare Advantage plans just chasing the free stuff, and that never ends well. So, across New Jersey here, more Medicare beneficiaries are starting to ask a question: should I leave my Medicare Advantage plan? While Medicare Advantage plans can offer low monthly premiums and extra benefits, they aren't always the best long term fit, especially as healthcare needs change. Understanding why people in New Jersey are switching away from Medicare Advantage can help you make a more confident decision. Limited doctors and hospital networks. There are network restrictions, and most Medicare Advantage plans function as HMOs or PPOs, which are networks. And I know that before you were 65, for 40 years, you were enrolled in a managed care plan and thought, well, it's just going to be the same. Yes, it's just going to be the same, but you haven't explored original Medicare and the freedom of networks, which I'll get into. You must use in network doctors and hospitals. Referrals may be required. Traveling outside New Jersey can, in fact, complicate coverage depending upon the plan that you have. As Medicare needs grow, many beneficiaries prefer the freedom of original Medicare, which allows them to see any provider nationwide who accepts Medicare. No chains, no network. Unexpected out of pocket costs. Many Medicare Advantage plans advertise $0 monthly premiums, low co-payments, extra benefits like dental, vision, and hearing. However, real world healthcare can use, I'm sorry, let's start again. I can't read. Real world healthcare use can reveal higher than expected costs. You visit specialists frequently. You need outpatient surgery or treatment or experience illness or hospitalization. Although Medicare Advantage plans include an annual max, that limit can still reach thousands of dollars a year. And with medical inflation surging, the maximum out of pocket will continue to rise. So if you're watching this and you're in a Medicare Advantage plan, take a look at your maximum out of pocket or total cost that you may have to pay for utilization during a given year. Another big one is prior authorizations and care delays. That's a growing frustration. Some services that may require plan approval before care is provided include MRIs, CT scans, skilled nursing or rehabilitation care, certain medications or treatments. For some New Jersey beneficiaries, these approvals can mean delays, denials, added stress. You probably have gone through something like that. Medicare Advantage plans change every year and they are not permanent. These are the things that can change: provider networks, prescription, co-payments, and the supplemental benefits. That free stuff is usually the first thing to change. The plan that worked well last year may not be your best choice this year, so it's important that you have to review during the annual election period. So many seniors will switch to Medicare supplement plans. As people age, they want to have the predictability and flexibility that often comes with that security of original Medicare and a supplement, and it's more important than low premiums. That's why they go back to original Part A and B. They get a Medicare supplement and a drug plan. And it's important to note, if you're in a Medicare Advantage plan, during the annual election period, you can go back to original Medicare for an effective date of January 1st. But are you healthy enough to pass medical underwriting into a Medicare supplement plan that will cover the 20% that original Medicare does not? You have to ask yourself this question, because when you first selected original Medicare and then you decided to leave to go to a Medicare Advantage plan, were you aware that you can go back to original Medicare, but then you may not be able to get a Medicare supplement plan? So that's important. The combination typically provides you have nationwide access to doctors, very low out-of-pocket medical costs, and stable long-term care coverage you can rely on. Now, should you leave your Medicare Advantage plan? Not necessarily. Some like that Advantage fit, and some like Original Medicare. Medicare Advantage still may be a great fit if you're relatively healthy and are comfortable staying within the provider networks and prefer those lower premiums. But if your health, doctors, or financial priorities have changed, it may be time to review your options. We can help review, but right here, if you're relatively healthy, you should think about changing, because when you get unhealthy, you probably won't be able to change. So we can get help comparing Medicare plans right here in New Jersey and just giving you the peace of mind. So our agency can help you compare Medicare Advantage versus Medicare Supplement, review total yearly healthcare costs, check doctor and hospital access, and understand your enrollment periods and the switching rules so we can tell you what you need to do in the future. So what we're here to do is just prevent those surprises and educate you so you can know what your healthcare is like and then forget about it and then have fun with your family and enjoy the retirement and the life that you really want to lead, and not be so hyper focused on, am I going to be able to pay for my care? Toby Stark, Stark Associates Insurance Agency, decluttering the Medicare maze. Thanks again.